Oh, hello. Good evening, boys and girls. Or excuse me, should I say boys, girls, non-binary, him, they, them. That's the thing nowadays. In the past 15 to 20 years, we went from having two genders to having, I believe, we're up to 53 at this point. Some of them mean the same thing. Uh, However, that does not change our current physical happenstance as what we're born, male, female. Yes, there are some different designations that are genetic abnormalities, such as hermaphrodite and things of that nature. But in the cath lab in which we work, we primarily have dealt with male and female sexes. Why is that relevant? Well, let's just say, for instance, in Germany. I don't know if you're aware of this, but it is a higher probability of a woman to have a chronic ischemic heart disease. What does that mean? It means she's gone in for checkups, she's gone in for her healthcare visits, and over the time, it's just been discovered, and she's been diagnosed with chronic heart disease. However, a man or men in Germany forego the annual doctor visits and their minor chest discomforts and shortness of breath, and end up with an ischemic MI. Uh, that's in Germany. Uh, so that is treating our patients based on their sex nowadays. Here's where we have a problem in the lab. Patient A comes in. Patient A is genetically a male, or excuse me, a female, but they identify as a male. No, that's fine. First and foremost, you don't want to offend them. So how do you do that when you don't know what they want to be called? Well, you call them what the name is on the sticker. Typically, they come in with a name and an armband, and you identify this is who they are, and they'll say, "Oh, absolutely, yeah. I know it says Sally on my armband, but I go by John." Oh, fantastic. Okay, John, not a problem. We'll go ahead and get you taken care of. Well, Sally's a female, and in the cath lab, if you're a female, a genetic female of a certain age, we need to have a pregnancy test done to make sure that you're not with child, no matter what the circumstance may be, unless you've had some sort of surgery that would eliminate you from the population of being able to have children. We need to have that pregnancy test. And this is not something that the doctor might not have known. So we get that test ordered, confirm that we're not going to be exposing any unborn fetuses to any unnecessary radiation, and then move on with our study. Now, if it's the other way around and it is a gentleman or a person coming in born as a male and comes in identifies as a female, it's in our lab. It's a little bit of equipment snafu, nothing major, but we have to change from using one catheter to another that has a larger reach because, or a smaller, or no, a larger reach because the uh, aortic root is a little bit extended in the male anatomy versus the female anatomy. Now, this is something that we figure out and we move on. Um, could there be a lack of gender based medicine? Well, absolutely, there is a lack of gender based medicine. And the reason being is gender is something that is seen chemically, is not something that we are treating. We don't treat gender. There are not studies based on gender. There are studies based on sexes, and we can treat the sex of we can treat based on the sex of an individual a lot more aptly than we can a gender. For instance, um, there's no men have higher probability of diseases versus women, and then vice versa in other cases. Um, so, is it an impact? Uh, does it negatively impact that there's a less gender-based preventive medicine? I wouldn't say so. Again, because we're not trying to treat somebody based on their gender. We need to treat the physical body, which is based on their genetic makeup and what they're born as. So they may identify and gender of one of one gender, but we can't treat what they identify as. We treat what they are genetically are. For instance, I can't come in and identify as a washing machine and go to a appliance store and say, "Hey, my I'm not feeling good. Can you fix me?" Well, no, sir. You're a person. It's like, but I identify as a washing machine. So why can't you fix me? Well, because you're a washing machine with blood and bones, not mechanical parts and a door. So, now if you want to obtain the trust of individuals and secure that trust, it's just best to identify them. Excuse me. It's best to identify or speak to them as what they identify as. The moment you start to speak with them as what they identify as, then they tend to lose trust and become aggravated with you and become guarded and closed off. And that's not anything you want. You need your patients to be open with you and communicative. So when you see your next patient, begin to think about what they want, what they identify as, and what they are, and just be courteous and treat them the best way that they can, the best way that you can, and the best way that they should be treated. Thank you. Have a good night.